Welcome to AETCM, the Emergency Medicine Channel. A 45-year-old female presented to ER with complaints of dog bite over the right lower leg. On initial 10-second assessment, patient was conscious oriented, airway was patent, no pooling of secretion, breathing, respiratory rate was 18 per minute, saturation 98% room air, circulation BP was 140-90 millimeters of mercury, pulse rate 92 per minute, all peripheral pulsations equally felt bilaterally. Disability GCS was 15, bilateral pupils equally reacting to light, and exposure GIBS was 110 milligram. Coming to history, a 45-year-old female who is a non-case of hypertension presented to ER with alleged history of dog bite bite by the dog of the neighbor on the right lower leg. The dog was fully vaccinated and the history of bleeding from the site was there. She initially just cleaned the wound from the home itself and then she came in here. On local examination, the wound.
So how should we clean the wound if the patient is coming without cleaning?
Around by the running water with soap and water, we should clean for about 10 minutes. We should clean the wound. Do not apply any antiseptics.
If it is so initially itself, if there is any active bleeding, just give compression and allow it to stop. Then after that, we need to clean. If the bleeding stops, then we'll have to properly clean. How should we clean?
By thorough
washing with soap and water. Then we should after cleaning, what should you do?
Dry the area.
After that, inspect for any foreign bodies, any dirt or any wound is there. If that is there, that should be big foreign bodies and all, that should be irrigated and cleaned off. Then after that, if at all, if there are many debris, then irrigate with water.
Okay. And the wound was like a puncture wound over the right lower leg, about 5 centimeters above the lateral malleolus. No active bleeding was present when the patient was in ER. So we also clean the wound thoroughly with soap and water.
So in the local examination, what all things you should specifically look for?
The type of wound, should it is lacerated or puncture wound or just abrasion, anything, active bleeding there or not, any foreign bodies, and proximity to the joints should be noted.
Proximity to joints or any muscles or tendons. And bone also, that should be checked. Then
look whether how deep the wound is, if there is an exposure to bone.
Then always look for the neurovascular deficits. If it mostly it won't be there, but you need to, while you are telling the local examination, you need to also mention about the distal pulses and also the sensation around the area and distal to that area. That also should be mentioned. And we must also check for if this patient came immediately. Other individuals and all, if there is any, sometimes individuals might come after some time. So any chances of infection or if it is late presentation, any infection, that also should be mentioned. Okay, so which all wound are more prone for infection?
Deep wound.
Deep wound.
Then when there is this proximities, very
proximities to the joints
or tendons. Then dirty wounds.
Dirty wounds.
In foreign bodies, if tooth is there. And then palms, soles, and facial wounds.
Okay. Okay. And any patient's condition, if the patient is immunocompromised, having some cellulitis or any lymphedema, such as PVOD patients and all are more prone for infections. Okay. So this was a dog bite. So which all animal bites are considered as tetanus, rabies prone?
Dogs, cats. Squirrels.
Which are high risk, which are low risk?
High risk are dog, cat, and bats.
Dog is there, bat is there, then raccoons, fox bites, these are considered as high risk. Low risk are cat, squirrel, rabbit, rat and all are considered as low risk. Okay.
Then we proceeded with, since this is a category 3 wound, because history of bleeding was there, we proceeded with vaccine and immunoglobulins, and we also given TT vaccination because she was not remembering.
So what are the categories of dog bite?
Category 1 is only licks on intact skin. Category 2 is only minor aberrations without any bleeding. Category 3 is this lacerated wound with bleeding or licks on broken skin and exposure to mucosa.
Okay, so when will you give rabies immunoglobulin?
Rabies immunoglobulin is indicated in category 3.
Category 3 dog bite. Then exposure to bat and bat induced injuries. Whatever category it is, better to give immunoglobulin. Then any exposure of our mucosa to the animal saliva or the animal's nerve system or brain, that also should be vaccinated with immunoglobulin also. Okay.
So we give vaccination with intramuscular regimen we followed here.
So here what all things you are planning to give? Vaccine, then immunoglobulin,
then tetanus prophylaxis.
Okay.
So initially vaccine we followed IM protocol 037 14 28. First dose should be given. The 0 dose is the first dose.
How much ml?
0.5 ml.
0.5 ml of rabies vaccine should be given. Where should be given?
IM on the deltoid or the thighs.
So in this individual you are planning to give immunoglobulin. So immunoglobulin should be given more proximal to the wound or away from the wound?
Immunoglobulin around proximal to
around the wound. And if excess immunoglobulin is there intramuscular, that should be given around the wound. Whereas if you are giving vaccine, that should be given away from the site you are giving immunoglobulin. So this should be given away. So 0 first dose we will be giving now. Then we will be giving 3rd day, 7th day, 14th day and 28th day. So this we are giving intramuscular. What about intradermal?
Intradermal, there is 0, 3, 7 and 28.
28. Instead of 14 we will give 0, 3, 7, 40, 28. Directly 28.
And it's
how much ml?
0.1 ml given intradermal at 2 sites.
Okay. Suppose one individual is coming. That individual might have taken rabies vaccine. Suppose intradermal vaccine from a local area and now has come to our hospital and we have only IM. Will you continue the IM vaccination? Will you continue it as intradermal or IM? If only IM is available in the hospital, what will you do? Will you change the intradermal vaccine schedule to intramuscular?
Since there is only IM, you can change to IM.
Don't change like that, because intradermal and intramuscular is having different immune reaction in the body. So this patient was already on intradermal and is getting immunity through that way. So if you immediately change to IM, that immune reaction, that thing will subside away. So if the patient was already on intradermal, don't change the schedule to an IM schedule. Okay.
Immunoglobulin.
Immunoglobulin. What immunoglobulin was given?
Here we have monoclonal antibodies and human immunoglobulins. Monoclonal antibodies, it is the dose is 3.33 international units per kilogram, and the human immunoglobulins is 20 international units per kilogram dose.
Okay, so if you are giving even human rabies immunoglobulin is there and monoclonal is there. Both are expensive, but more expensive is the human rabies immunoglobulin. So the dose of monoclonal you have told 3.33 international units per kg. So how much will there be in a 1 ampule?
1 ampule it will be 100 international units
per kg. So mostly in adults we might have to give two ampules. So how will you give it?
We will give a maximum around the dose, like
around the wound,
around the wound subcutaneously with, and its excess is there. Then we will give IM dose.
IM almost near to the wound. Okay. HRIG
in 1 ampule there will be 300 international units.
What is the dose required?
20 international units per kg.
Okay, that also same, more over the local area and rest IM. Okay. Then what about other things are immunoglobulin available?
equine immunoglobulin is there. The dose is 40 international units per kg, but chances for reactions is more.
So that also one ampule contains 5 ml. In that 1500 international units are there. Okay. So that is equine. Okay. Then what else should you do?
Tetanus prophylaxis can be given. For if it is clean wound, no immunoglobulins are required. And if the doses means the previous doses is unknown, we can give the tetanus vaccination. If the previous dose is known, if it is more than 10 years only, we should give one dose. If there is all other wounds other than clean wounds, if the unknown dose is there, we should give the both vaccine and immunoglobulin. And if the dose is known, means within previous doses is known or immunization status is known, if it is only more than 10 years, more than 5 years, we can give.
Okay. So suppose you have a patient who is on IM injection. So the patient received 0 dose, 3rd dose, 7th dose, and now came for 14th dose. And patient was complaining that each time the patient is taking this vaccine, rabies vaccine, is having a reaction to that vaccine. So at the time of the 7th dose, patient had somewhat like an anaphylaxis features and all. So what will you do? Will you continue giving the vaccines?
Give with precautions.
So 0, 3, 7 taken. 14 and 28 is left.
With precaution we can give.
The thing is, if the patient, this patient's dog is neighbor's dog. So if the patient has observed the dog and if the dog is normal for the next 10 days, so at the 10th day if the dog is normal and if the patient is having a reaction to this vaccine, we can avoid the vaccine if the dog is okay for the 10th day. Okay. Then what else should you give? When all will you give antibiotics? What is the antibiotic of choice?
Augmentin.
Amoxicillin, clavulanic acid. Okay. When all will you consider giving antibiotic?
When the wound is very deep and it is a contaminated wound, and if there is signs of inflammation is there, if the edema is there, then if the patient is immunocompromised, we can give oral antibiotics.
Then any wound to the face, then patient is having some proximity to the joints and all, and any neurovascular compromise. And some relative indications are patient is having some bite directly to the hand or foot, or previous cellulitis or other infections, or any crush injuries to that area. Then also we will considerably giving. And if the patient presented more than 8 hours after the bite, then also consider giving antibiotics. Okay. Then so this patient only tetanus, immunoglobulin and rabies vaccine also only given. Okay. Anything else?